Hello, my name is Mary Ellen West, and I am a certified nurse midwife and certified sex counselor working with the Merle Cancer Care Center at Island Hospital in Anacortes, Washington. Today I will be talking with you about sexuality during and after cancer treatment. Cancer changes everything. It's a before and after diagnosis. Among the areas of life that change dramatically with hearing the C word is sexual intimacy. Of course, sex is not the first consideration that comes to mind when an individual receives news of a cancer diagnosis. In fact, it may only become obvious that intimacy was affected a year later or after treatment is completed and one begins the journey of survivorship. Many aspects of treatment and recovery make sexual intimacy more challenging. For example, pain, fatigue, nausea, immobility, body image changes, erectile difficulties, and depression are all common among survivors and can impact an individual's sexual function. We know that at least half of all cancer survivors will identify sexual functioning among their physical concerns, but traditionally most have not received information about sexual functioning in survivorship. Many expected their caregivers to ask, and this is complicated by the fact that talking about sex is not easy for some of us. Sexuality is a very intimate, individual, and vital part of the human condition, and we would like to address it with our cancer patients and survivors. That is the role of the sexual counselor at the Merle Cancer Care Center. Meeting with a sexual counselor is completely voluntary. There are some cancer diagnoses that may make it especially valuable, though. Those include, but are not limited to, uterine, cervical, prostate, and rectal cancer, since treatment directly affects the pelvic region. In addition, breast cancer survivors commonly benefit from addressing issues of sexual function as early as at the time of diagnosis. Sexual counseling is not long-term or intensive, but consists of permission-giving, limited information, and simple suggestions to help survivors find a new normal of sexual functioning after diagnosis and treatment. It may be as simple as changing the timing of intimacy to combat fatigue, or as complex as the use of medications to enhance the experience by avoiding pain with sex. Survivors will typically see a counselor for no more than a total of 6 sessions. When is it time to seek help for sexual complaints? If sex has become painful, or if a man has difficulty getting or keeping an erection, you may benefit from seeing a sexual counselor. Another example would be if one has no desire for sex and it is causing stress on the relationship. We know that being able to function sexually is an important part of feeling like a complete human being. It can be difficult during and following cancer treatment. However, it can be recovered or even enhanced by giving sexual intimacy special attention in survivorship. Thank you for listening to the Merle Cancer Care Center's Oncology podcast program on sexuality during and after cancer treatment. For more information or to schedule an appointment, call the Merle Cancer Care Center at 360-299-4200.